Swayam Prabha. Digital India. Educated India.
Our dear conference chair himself, Professor Raj Srinivasan, and Raj and team, the work that they did, and they're going to present this towards ensuring the integrity of pharmaceutical cold chains, multi-perspective models for risk assessment.
Thanks, Robin. So this is kind of a Siamese twin of the talk that Shrikant just addressed. So all of us over the last 2 years or so have taken at least 3, maybe 4, sometimes more vaccines in our arms. We also know of people who have taken the vaccine, but nevertheless they have tested positive subsequently. Obviously, the consequence might have been much lower, and we can assume that we somehow got infected somewhere along the way and results will have the job. But it's also eminently possible that perhaps the jab that you got in your hand did not deliver the intended effect. It's probably less likely for people like us in the Zoom. It's very, very likely, a lot more likely for people in the lower income countries particularly. So what we have been trying to do over the last 2 years or so is collaborating with Shrikant and his group in Research Institute in Canada. Our students, research students here in IIT Madras have been asking the question, is there a way that we can look at this issue of the quality of medication, or particularly integrity of medicine in a systems-based approach, using PSC tools, techniques to first of all understand what's the root of the problem, and then try to systematically design interventions which can help deal with this. Right? This clearly is not purely process plant, it's not just the human, it is it's a social system, it's a regulatory system. We are dealing with a number of players that Shrikant alluded to in his presentation. So,
the nature of the problem is something, again, I'm just stealing this slide from Shrikant. We know from anecdotal data that if you go to the market, especially in low middle income countries, buy medicine off the shelf, test them for the intended effect. Roughly 90% of them will, in the lab, show that they will do the job. Roughly 10% of them will show that the job is not going to be done, even if you take in poor income countries, that number is horrible. 50% of the vaccines end up being such poor quality that you're happy that they don't get into people's arms, right? One of the issues which is very prevalent is many vaccines and many other medical products require that the temperature be controlled in the entirety of their life, from the point they are manufactured, when they leave the factory gates, till they get to your arm. This is called the cold chain. Some of them, I think after COVID, most of us know, some vaccines are relatively easy to transport. They require a temperature range of 2 to 8 degrees. There are many others which require far deeper refrigeration. The more refrigeration that's required, the more challenges do supply chains face. Okay, so for the purpose of our presentation today, I'm going to be focusing on this typical range of 2 to 8 degrees Celsius, where many medical products, and sometimes even food products, have to travel through. The economic burden, again, this is something that you have seen already. If you look at it in dollar sums, you're talking about out of $30 billion. If you look at it in terms of impact on people and their lives, 70,000 deaths in childhood due to pneumonia, 3 to 9% malarial deaths, particularly in sub-Saharan Africa, and so on and so forth. One can spend an entire hour just talking about these statistics. But like I said, my purpose is not really just to say that this is an important problem. my purpose is to then ask, what is it that we can do about it as systems engineers? So in the last 2 years, we have said, let's understand how these supply chains are supposed to function. What's the ideal state? How do they function in the real world? What are the gaps? And therefore, what are the failure modes which are causing the issues that I talked about? Figure out how often these are occurring, and then their significance on the final outcomes. So we looked at it from a cold chain point of view, because that's perhaps the place where one can make the maximum impact. We looked at situations where the products which are being transported could be vaccines, it could be eye drops, it could be insulin for diabetes, it could be many other biologicals. And now all of this, you want the entire journey from the factory floor till it reaches the intended recipient to be within in a temperature controlled range. So why is this temperature control important? If you think of it as a chemist or as a chemical engineer, what happens if temperature either exceeds 8 degrees or sometimes even goes below 2 degrees? So if you freeze it in the refrigerator and the product is frozen, will it still not be good enough? The answer is in many cases, no, it will not be good enough. Why? There are physical changes which happen to the molecules or the formulations. You could have separation if you have emulsion in your product. You may have sedimentation of active ingredients. You may have loss of volatile components, or you may have the crystal structure that I think Vipin referred to, protein folding and such. The crystal structure is very, very critical to get the intended effect, and that structure may be lost. So that's the reason why cold chain is, from a chemistry and the science point of view, very important. So, industry in practice uses a number of devices like shown here to ensure that temperature can be maintained. And it could be as simple as an ice pack that you probably have in your own freezer that you apply anytime you have pain. It could be something like that. It could be a lot more, it could even be an active device where it requires electricity to maintain the temperature. In many cases, just an insulated container. Right? So if you look at the journey from the factory floor to the hospital or wherever it's delivered, we have various different players who are playing a role in ensuring the integrity of the medicine. I have just a sample here. You have warehouses where these products are stored, sometimes for a couple of hours, sometimes for a couple of months or longer. Right? You have refrigerated trucks where these are transported, perhaps from the factory floor to a distribution center, to a airport, and so on. Or again, from an airport to a distribution center to a hospital. You have other people who are passing information along, who are just ensuring that the coordination between the various physical movement are all done in sync, right? And so these are, for example, freight forwarders. And finally, obviously, you have the regulators whose job is to make sure that any medicine which lands on your shores, in your country, has the efficacy that is desired. So all of these people have to be orchestrated, and that's where sometimes the problems really originate. So how do we model this? So as a risk person, the initial step we took at this problem was to look at it purely as a qualitative problem. So many of you are familiar with reliability engineering and process safety and so on. There are standard techniques like failure modes and effects analysis, which can be applied to any systems description. So here's an example of how we approached it from a risk point of view. As a first step, we mapped the supply chain. We performed extensive literature survey to understand what are the various failure modes, which typically bedevil different steps in the supply chain. Calculated probabilities of occurrence of various failure modes and also the effects that occur, and then wrapped it all into a single risk number. Those of you who are familiar with FMEA, this is called the risk priority number, which is a product of the severity of the outcome, how often would this outcome arise, and then how easy it is to detect it, because if it is detected, you perhaps can fix it, for example, eliminating that batch from being released to the market. So when we analyzed using FMEA technique, here's an example. Let's say I'm in the process of transporting vaccines from my warehouse to the airport. I might have, so I'm doing it by road transportation. If for whatever reason, the truck driver decides to turn off the air conditioner This room is perhaps very cold now and you want the air conditioner to be turned off, but during refrigerated container based transportation of the vaccine, you probably do not want the air conditioner ever to be turned off, especially if you're in a weather like India, where the outside atmosphere may be 40, 45, even higher temperature. So if for whatever reason the truck driver turns off the air conditioner, you want that to be something that shows up in your analysis. So if you take that into account, calculate the risk priority number for an event like this, we find that it's fairly high. It turns out that for various primarily cost related reasons, it's not unusual, perhaps it's more usual than you would like it to be, that drivers end up turning off refrigeration so that they can save fuel, right? That leads to issues, and it's not easily detectable. If you are a regulator sitting somewhere else and if the product does not have a temperature logger, you may never detect that this batch had this temperature shock in its journey. So we did this analysis for about 150 different failures which could occur, and what we found was there are roughly about 8 or so failures which are really, really significant. So here is a list of those. Many of them relate to air transportation, as you can see, and these issues arise from primarily information related issues, data entry. So you may have a product which requires the 2 to 8 cold chain, but when the freight forwarder put it in a container and put it on a pallet and he loaded in the plane, perhaps all he did was he put the wrong label on top. So he forgot to put a label which says that temperature has to be 2 to 8. So when it gets off the plane in a transit airport, let's say Dubai, the people on the ground who are not going to open the package, who are just going to look at the pallet out there, they may not store it in the right conditions before they load it for its onward journey. So things of that nature, information oriented, can cause havoc. There are a number of others that you can see listed here. So that's what we did as a first step, to understand what are the failure modes which can cause the maximum impact. The next thing we did was to say, this gives us a kind of a bird's eye view. Let's now dive deeper using discrete event simulation to understand how much of an impact on the product quality would it have. So far, I have said kind of a product either makes it, it's good enough, or it does not make it and it should not go through. But obviously, product quality is not a binary, it is a continuum. So you need to understand, is the impact going to be a few percent, 10%, 20%, which is still good enough to be given to the patient? Or is it that the quality has dropped all the way to a 20% level and you probably don't want it to reach the patient? So we use a discrete event simulation for that purpose. Quality is modeled to take the effects of time, of temperature, number of other factors. And I probably don't have the time to dive into this. Basically, we said, how long is the typical operation of the supply chain? How long does it spend in the warehouse? How long does it travel and so on? And we simulated a number of shipments. And over time, what we found was that on average, based on literature data, any shipment sees 3 unplanned interventions, right? On average, even though that could be 40 or 50 different things which could all go wrong, no shipment has all 40 things lining up to cause mess. But it's not like it is 0 either. You have 3, 4, 2, that kind of number of events which happen, which end up degrading the quality. And that's what is shown here. But what was really fascinating for us when we studied this problem was the following. What you see on the right-hand side is the average time spent by a shipment in the journey. The blue circle is the time it is in, and the blue part of the pie is the portion where it is in transit. Notice that it's almost like 80% of the time the shipment is in transit, which is a good thing. You don't want the shipment to be sitting just there. But if you look at average damage which arises to a shipment, it mostly happens during manual handling. So if you look at the picture on the right, you notice that manual handling is only like 5% of the time, but it leads to nearly 70% of the damage. Why is that? Because if you have laborers who are loading, unloading pallets, boxes, etc., they may cause physical damage to the packaging, which then ends up propagating to the product itself. Right? and so on. So I can again dive a lot more into details, but I probably don't have the time. So I want to just talk about one last bit that we did to kind of close the picture. So far I said we did a failure modes to get a qualitative sense of the story. Then we did a discrete event simulation to understand how we can understand the distribution of quantitative performance. The third thing we did was looking at it from end use point of view. So imagine that during loading, the freight forwarder noticed that the laborers who are loading the pallet have mishandled. He could either take a call to continue with the shipment, or he can say, there's something wrong, let's not send it out, right? That's a possibility. So you want to know what will be the consequences once a particular problem has occurred. What will be the consequences that this will lead to a poor outcome, right? So vice versa, you can say that I observe that I have shipment I have received in my shores, and it seems to have gone through a temperature excursion. If I want to do an investigation so that I can go fix root causes so that subsequent shipments do not have this kind of an issue, I need to understand from investigation and then a system fixing point of view, what are the places where this could have possibly happened. So looking forward in time to say what will be the consequences of this particular event, or looking backward in time and saying what are the mechanisms I should place in my system, in my supply chain to prevent such occurrences. So we have used the Bayesian networks or Bayesian causal models for that purpose. Again, interest of time, just zoom in. So like I said earlier, if I say I have a bad handling by a warehouse employee while loading a shipment, what will be the consequences? You can get a probability distribution. What that table tells you is that on average, you're going to have a 40% degradation in the quality of your product. So you have a numerical basis or quantitative basis by which you can decide whether this is good enough to go or you want to kill that shipment at that point in time. That's a 10% probability or 11% probability that the shipment will be damaged very badly, and a very small probability that it is going to meet your high standard requirements. Similarly, if you do a backward propagation, I notice I receive a shipment which has had very high damage. Looking at it backwards, what could it have occurred? 56% of the time due to let's say delay in loading, or 37% of the time because of power outages. So notice that here we have built a model. We have built actually 3 different types of models. One, a qualitative model to do a failure modes analysis. We have done then a numerical simulation where we can do Markov kind of analysis. And finally, then we have also a causal network, which gives us various kinds of insights. All of these techniques are something that this community is very, very familiar with. You do this in your undergraduate education. But applying it to this domain of healthcare is something that we are not probably done as much. And that's what I would like to encourage this audience to do. So with that, I just want to talk to the role of data. This is something that almost every talk throughout the morning 2 sessions I've been talking about. Data has a big role in everything I've said. Here I have talked about building Bayesian models. I talked about building discrete event simulation models. All of these have parameters. All of these require ideally real data. And with the digitalization and the data revolution which is ongoing, this is now becoming possible. So if you, as a player in the supply chain, anywhere in the supply chain, these interventions that I talked about are very much possible. So with that, let me kind of close with saying that cold chain failures are a big deal, right? It is something that is often hidden, and it can lead to poor outcomes. On most occasions, these poor outcomes are faced by people who probably are not, I don't know what's the right word, smart enough to realize that. So it's the role of the scientific community to make sure that this gap is dealt with. We have given you one example. There are many other ways of approaching this problem, and I would again encourage all of you to have a look at this. With that, let me stop. Thank you so much for your attention.
Thank you, Professor Raj. This is indeed a great example of how this community can impact questions in healthcare. So, any questions from the audience? Yes.
Thank you for the very nice talk. I might not have understood it completely, but I had a question about the FEMA example that you showed, and you showed some scores that you assigned. So I wanted to ask, like, how did you assign those scores, and how did you go about standardizing the assignment of those scores?
So that's a good question. So this goes back to the core question of data. So you need to take a system and understand what are the various failure modes which are possible. In our case, we are working with a model system which is built based on information from literature. But if you're actually working with a company, then they probably have the data to tell you what goes wrong in the system, who are different players, how reliable are they in different steps, and such. Then you would basically replicate what you have done for our model case study to that particular.
Any other questions?
Thanks, Professor. Excellent talk. I am Senthil from Pfizer. So, do we have, a confirmatory test? Let's say I have a vaccine, then after a week or so, am I get tested? Can we have some tracers which ensure that sufficient precautions are taken while the vaccine is being transported all the way from the factory to the clinics? Maybe a question to Srikanth actually.
So let me give you one flavor, and then I will perhaps ask Srikanth to also add to that. Basically, we are the proof of the pudding is in the eating, right? So ideally, every shipment which reaches the shore, you want to send it to a lab, appropriately WHO certified lab, which can figure out if the efficacy is in there. That's possible. That happens in some countries. The kind of countries that we have been working with or talking about, with Srikanth, including Sub-Saharan Africa, sometimes the country does not even have a single WHO certified lab. So the question of proof in the pudding is very, very difficult. The second thing is obviously you can put data loggers, temperature sensors as part of the shipment. Again, ideally it can be done, but it adds a fairly significant cost to the cost of procuring the vaccine. Again, it works reasonably well in rich countries, in poor countries, so. Is there other lower cost, cheaper interventions are possible? You see these little dots on the bottle which change color if they have temperature excursion. So those kinds of technologies are there, but not as widely in use as one would think. I hope that kind of answers your question, but I don't know if Srikanth would like to add to that.
I think Professor has answered that question. So there are solutions available. The question is, can we create these solutions that can be scaled at the levels that are required, and can cost be reduced so that they can be effectively used? Unfortunately, as of now, the only means by which you can, for a country like a country that's in sub-Saharan Africa, the only means by which you can verify the efficacy or the quality of the medicine is through visual inspections. They actually watch the shipment come in at the airport and see if there is a visual damage to it or not. That's the only mechanism, and that is, as you know, will not tell you whether the medicine is actually being compromised or not.
Well, thank you. Thank you, Professor Raj. What a fascinating and timely application of the techniques that we discussed.